Israeli humanitarian NGO Save a Child's Heart performed its 5,555th life-saving procedure last week. Around half of those procedures are dedicated to treating Palestinian patients. The organization not only brings children from the Palestinian territories and abroad to Israel for life-saving treatments, it also trains doctors within these regions to perform the surgeries locally, learning directly from Israeli health experts. Now, for this milestone procedure, the NGO treated a 5-month-old Palestinian boy from Gaza named Mahmud, suffering from life-threatening illnesses. Mahmud was brought to Wolfson Medical Center in Holon for the treatment, where he underwent surgery to save his life. Now, let's hear from the doctor who performed that surgery, saving his life, Dr. Sagi Assa. He's a pediatric cardiologist from Wolfson Medical Center, and he also, of course, works with Save a Child's Heart. Thank you so much for joining us today.
Thank you.
So first of all, I'd like to know, how did you get involved with this organization?
Actually, I was working at a pediatric residence in Wolfson Medical Center. There I first was acquainted to Save a Child's Heart. And since then, thank goodness, I'm there operating with my team on children from all over the world. This is a privilege to work as a team. It's a teamwork, since the children coming to us suffer from life-threatening defects in their hearts. It needs a team approach, surgical catheterization, invasive care, teams, and all these abilities to operate and save the lives of so many children is due to the organization and the medical teamwork. And this is what we do on a daily basis in Wolfson Medical Center.
So the surgery that you performed was number 5,555. Now I'm wondering, why is that number such a milestone for the organization?
Yeah, amazing. This is the 5,555th case we've been performing on life-saving operation and catheterization. And we are very proud to save so many lives of so many children from all over the world, Palestinians, Arabs, Israelis, African children. Mahmud, this cute little boy, was operated as a very small child at the palliative operation when he was a baby. And he came now to his final procedure, where to allow him to live a normal and good health life with a normal heart.
Can you be a little bit more specific about what exactly was wrong with this little boy that you helped save his life? And how did his parents become involved with the organization and actually find out that there was this service that could help their son?
1% of all born children are born with a defect in the shape of their heart. And this needs some intervention to be able to let them live normal life with a healthy heart. Mahmud had a very big defect inside his heart, and this could not be fixed when he was a small baby due to his size. So we've done an in-between procedure to protect his lungs so that they will not be overflooded. And this allowed him to grow, and the defect became smaller and smaller.
Wow.
And now that the defect was closed, we had to debend, to open the snowring we created. And this is what we've done in the cath lab, in a procedure called catheterization. So we used the balloon to dilate again his heart and his pulmonary arteries, so he will become again normal. And now he can have a normal, healthy life.
Wow, that's really, really an amazing story, and amazing that you were able to save his life. We know that Mahmud comes from the Gaza Strip. I'm sure that's extremely politically sensitive to bring a patient, especially a child, from Gaza into Israel. What's involved?
So going back to your first question, we have colleagues in Gaza working with Save a Child, doctors, physicians, and people who are helping us bringing these children and help the families know about this organization, we all together, not only the medical team, but all the Save a Child Heart family and many other people who bring their heart, their life, their time to help these children, help us bring all the children from Gaza on a daily basis. We also get a very big help from the Israeli government regarding crossing all the borders, getting the permission to come to Israel. Also in difficult times, when there is difficulties between both sides, in times of Corona, children are continued to come and get good treatment in our center, in Wolfson Medical Center.
Wow, you know, really inspiring and definitely important work. Dr. Sagi Assa, thank you so much for joining us.
Thank you.